Welcome to Nurses Uncorked, where I pour out the unfiltered truth about healthcare life. I'm your host, Nurse Erica, serving up real talk straight from the front lines to your ears. Each episode, I'm uncorking conversations that matter to nurses everywhere, from the hilarious to the heartbreaking, the inspiring to the infuriating. No filters, just authentic nursing experience shared with a splash of humor and a dose of honesty. So grab your favorite beverage, put your feet up, I know they're tired, and join me as we uncork another episode of Healthcare Reality. Now let's get this shift started. Welcome back to another episode of Nurses Uncorked, where nursing truth gets fact-checked, uncensored, and served straight up. I'm Nurse Erica, not just another nurse with a ring light, but the blueprint they borrow from, doing the research they skip, asking the questions they won't. Today, I'm interviewing Travis Nelson. He's a registered nurse turned Oregon State representative. He switched from nursing to politics, and wait until you hear some of the amazing nurse legislation that he is getting passed in that state. I can't wait for you guys to hear it. Don't forget to share Nurses Uncorked with your colleagues, leave a review, and download episodes. That's really important in podcasting. Download episodes. And if you really are enjoying the podcast, consider becoming a patron. There's a link in the episode description. Let's get into it. Welcome back to Nurses Uncorked. Today, we are joined by Travis Nelson. I'm going to tell you a little bit about him. He joined the Oregon House of Representatives in 2022, representing North and Northeast Portland in the legislature. He's proud to have joined the Oregon legislature as the first ever Black LGBTQIA+ member and the first LGBTQ+ man of color. The grandson of Louisiana sharecroppers, he put himself through community college and then Washington State University School of Nursing by working food service, landscaping, and janitorial positions. He's a former vice president of the Oregon Nurses Association, and in his career as a registered nurse, he specialized in emergency nursing, critical care, med-surg, and rehab nursing. Serving as a union representative honed his advocacy skills and allowed him to begin tackling many problems inherent in our healthcare system. In the 2023 legislative session, he was a chief sponsor of HB 2697, a bill that made Oregon the first state in the country to put nurse-to-patient ratios in statute. Welcome, Representative Nelson. Thank you for being here.
Hey, it's a pleasure to be with you, Erica. Good to see you. Glad to be on your program.
Yes, I know this is a long time in the coming. We've chatted on and off for a long time, and I'm so glad that you are finally here. All right, I've got questions for you. Let's get into it.
She's got questions, everybody.
Lots of questions. What originally drew you to nursing, and do you ever miss it now?
Wow. So I kind of fell into nursing by accident. My mom was a CNA and a medication aide for most of my childhood. And I'm somebody who barely graduated from high school. I graduated high school with about a 2.4 GPA. And
oh my gosh.
And really did not have any intention on ever becoming a nurse. I went back to community college in my early 20s and originally was going to be a teacher. And then one day, there's a story here, but I won't get into it. I came up short on my community college tuition because I'd messed up my financial aid. And I called my mom and I said, "Hey, Mom, I need $500 so that I can continue going to school." And she told me that I needed to consider nursing and give up teaching. And she said, "Look, I want you to go into nursing because if you become a nurse, you'll never have to ask me for money again." So I looked into it and I'd done a lot of the same prereqs because there's a similar initial path with teaching and nursing, like the English 101 and the Psych 101 and that stuff. And so I decided to make the move towards nursing. The best advice I ever got was to apply to a lot of different schools, especially as somebody who did not have the best grades because I had to work full time throughout my community college education and nursing school. And so I applied to, I think, 20 different schools of nursing, and I got into 2, and it was the best decision that I ever made. Becoming a nurse truly changed my life.
Yeah, both female dominated professions that are probably top of the list for abused, right?
Yeah, yeah,
Interesting.
yeah,
Do
absolutely.
you ever miss
Well, I
it
think
being bedside?
oh, yeah, there are times that I miss it. It's been about a decade since I've been away from doing direct patient care. Since joining the legislature, I have worked per diem in nursing in the hospital setting,
Oh,
but that
wow.
was doing employee health stuff. So it's not exactly the same type of work, but I definitely miss direct patient care. But the way I look at the work that I do now, both in the legislature and the work that I do with the Washington State Nurses Association, um, I look at that work as being about patient care because if I can help make working
Yeah.
conditions better for nurses and healthcare workers, then I make things better for patients. And so that's how I look at it.
What made you decide to take that leap from nursing into politics? That's a big leap.
It was a leap. And it all started about 20 years ago when I first became
Okay.
a nurse in the hospital setting. When I started my employment at Southwest Washington Medical Center over in Vancouver, I joined the union. And after about a year, I looked at my pay stubs and I said, "What is the union doing for me?" And not long after I started to question that, I got a notice in the mail saying that there was a union meeting. I showed up. I started asking questions, and the next thing I know, I'm on bargaining teams, and then I'm running for co-chair at the hospital, which is kind of equivalent to being the union president. And I won, served in that role for about 5 years. But while I did that work, I got involved with politics, knocking on doors, delivering lawn signs. That's really how I got involved. And then things really took off in 2008 when Barack Obama ran for president. And I went to his inauguration when he won.
Oh, you were there? That's amazing.
Yeah, yeah, it was really good.
So unions were kind of your stepping stone into politics.
Absolutely. Yeah. I don't think I would have
Yeah, I
gotten
figured.
involved with politics the way that I have if it weren't for the involvement that I had with a fantastic union at that time and the Washington State Nurses Association, and then later the Oregon Nurses Association.
Why do you think it's so important for nurses to hold elected office?
Wow. Because politics is in everything. I know there are people that say that they want to avoid politics, but whether it's nurse to patient ratios, how the hospital's getting reimbursed, rules around insurance, rules around EMTALA, right? Literally everything that we do in our profession is politics. And legislatures, it's mainly lawyers who are running for these
Yeah.
offices and making these rules up. And a lot of times nurses have very little input, especially in states where you don't have strong nursing associations or strong unions. So it's super important for nurses to run for office because we need to be in those rooms where the decisions about our profession and how patient care is delivered are made. We got to be there.
I wholeheartedly agree. We have to have a seat at every table or nothing's going to
Yeah.
change. Oh, from your perspective, what are some of the biggest challenges facing nurses in Oregon right now?
Well, I think workplace violence and staffing are huge issues. Fortunately, we've been able to move the ball on both of those since I have been a state representative. We've passed some major legislation around those. And I think the Medicaid cuts that are coming are definitely looming because those will definitely impact work environments for nurses, given the fact that we're going to see our hospitals take some hits.
Yeah, I think those are pretty universal challenges in all the states right now for nurses, unfortunately.
Yeah.
What are common misconceptions that legislators who are not in the healthcare sector, what are some of the common misconceptions they have about nursing and the healthcare industry?
Woo! I don't think they realize what it's like to work in a hospital. I think there's a lot of misunderstanding there. It's like for
Yeah.
a lot of us who became nurses before we actually worked in the hospital setting, we thought we knew what that was like until we actually started doing the work and realized that it's a lot harder than we had perhaps anticipated. And just to be frank, while there are a lot of good hospitals out there that are good employers. There are a lot that are not such great employers. And I don't think legislators realize that. I also don't think legislators understand the workplace violence issue and how often
Yeah.
nurses are kicked, hit, and verbally abused, and how there's this culture in nursing and in healthcare where it, that's supposed to be part of the job when it should not at all be part of the job. And when I tell fellow legislators that nurses are statistically abused at a higher rate than law enforcement officers, that comes as as a surprise to them.
Yeah, sadly, it shouldn't, but, the media hardly reports it, so I'm not surprised to hear that.
Yeah.
Let's get into policy and legislation because you've been busy.
Yes.
And
Yes. Yes. Yes.
and you have not lost sight of your roots, so to speak, in nursing. I think sometimes that happens with other nurses that have gone into politics, but you have really stayed focused on nurse centric legislation, and I love you for that. So let's just cover some of them. I did a little research. You sponsored a bill, HB 2748, concerning the use of AI in healthcare, which bans non human entities like AI from using the title of nurse. And that received a little bit of pushback from some who questioned how necessary the legislation might have been. How do you respond to critics that say focusing time and resources on that may only end up slowing the innovation as AI becomes more integrated into healthcare?
Well, this bill was not intended to keep artificial intelligence out of nursing. Rather, it was a bill that was brought forth to protect the title of nurse and nurses. I worked on this bill with the Oregon Nurses Association and the American Nurses Association, specifically Jennifer Minsick Kennedy, who is an Oregon resident. And unfortunately, the bill changed a little bit from where it was in the beginning. So the bill doesn't actually protect the word nurse, but it protects nursing titles. And so artificial intelligence cannot legally use those now in the state of Oregon. And only humans, now that this law has passed, will be able to use nursing titles.
That's great. And it's kind of sad that we have to even go there, but so important that you did. Oregon recently passed legislation around safe staffing. A huge, huge victory. I cannot state enough. Since HB 2697 was enacted, what is now the status regarding compliance and how do you ensure that the law's minimum ratios are being adhered to?
Yeah. Well, there are bugs that are being worked out, but from what I hear, by and large, hospitals across the state are complying with the ratios. And that is a bill that I'm extremely proud of. Worked with that bill with the American Nurses Association, the Oregon Nurses Association, and the Hospital Association actually ended up being a partner and bringing that legislation full circle as well. And so, from what I hear, by and large, it's working well. There are some hiccups as it relates to reporting and enforcement, but I think we're getting there. And it's been an honor to be a chief sponsor of the only bill in the country, only law in the country that puts nurse to patient ratios in statute. California is the other state with legal nurse to patient ratios, but my understanding is they were created by rule and are not in statute. Oh, and I want to give a shout
Yeah,
out to
and for
SEIU as well, the Service Employees International Union. The locals here in Oregon worked to get the bill across the finish line.
yeah, for over 20 years it has been just California, right? This lone state, no one thought it could happen, it could be replicated again and you did it. And kudos to you. That is amazing. Absolutely amazing. But I think I might have hallucinated for a second. Did I hear you say that the hospital association helped with this?
They did help. The Hospital Association did help. There were some things that they wanted that session as well, and so there was kind of a package deal. that was made to get the ratios across the finish line. But the hospitals were helpful in getting that done. Yes.
Okay. All right. Just want to make sure I heard that right.
You did. You did. They don't always love me for other things. We work well together on some things, and there are other things they don't love me for. But fortunately, we were able to find some common ground and get legislation across the finish line that met all of our needs.
Yeah. You previously introduced HB 2792, which would have required hospitals to disclose their spending on replacement workers during a strike, aka scabs. And that sadly did not pass in its original form, but I have to give you all the props for even introducing that because I don't know of any other bill, maybe there are some out there that have been introduced elsewhere for that and really innovative. And I hope that we see something along those lines in the future. But what do you hope the reporting requirement would achieve?
Well, really wanted some transparency there. This is a bill that I brought when the Oregon Nurses Association was having some tough labor negotiations with Providence and Portland. And I wanted to get a better understanding of what they were spending on replacement nurses. It's really hard to understand what these hospitals are spending their money on and how much money they're spending on things like scab nurses. Hospitals take a lot of public money, right? Whether it's Medicaid or Medicare, they take a lot of public tax dollars. And it's my opinion that there should be disclosure in all aspects of how they spend if they are taking that type of public money, which nearly all hospitals are. And so I'll be bringing that legislation back. That's not the last that
You
you've seen of
are?
it. I'm going to keep pushing.
Oh,
Oh, yeah,
good.
I'm going to keep
Good, good,
pushing.
good.
Not this next short session because we are bill limited, but the long session after that, I'll be bringing that bill back because it's important. If hospitals are going to spend, on some of these scab nurses, and you know this, they're spending $200 an hour sometimes on
Mm-hmm.
these replacement
Yeah.
workers. And again, a lot of that is public money. And so the public should know how that money is being spent and how much of hospital dollars are being spent on those nurses and replacement workers.
Absolutely. It all comes down to accountability. They hide that information, even the ones that have strike insurance, they hide that and it's like wrapped up in an enigma and no one can find it anywhere. I think it would be a game changer to force them to have that be public information. So I applaud you for that. Absolutely. Instead of HB 2792, the state legislature ultimately passed a separate bill, SB 916, to provide unemployment benefits to striking workers, which is incredible. Can you tell us about that?
Yeah, that's a bill that will allow striking workers, not just nurses who strike, but all striking workers in the state of Oregon to collect unemployment after they have been out for at least 2 weeks. And I think they can collect a maximum of, I think, 10 weeks of unemployment. From what I understand, that makes Oregon the best state in the country on that issue. There aren't very many states that actually do that at all, Nurse
No,
Erica. It actually surprised me when I first learned that folks who go out and strike, for the most part, do not qualify for unemployment. And to me,
it's true.
that seems like a travesty. Folks should not be put in a position in which they have to decide whether their children eat or whether they pay the rent when they are on strike. And so I'm really glad to be a sponsor of that bill, and I'm glad we got it across the finish line in Oregon.
Yeah, that's really a game changer and will absolutely help not just nurses, but workers make that hard decision to go on strike if they know that they have that to help support them. Yeah, so important.
Yeah,
Again, I applaud you.
yeah.
I just
I
applaud all
absolutely
of your work.
thank you so much. And I want to be clear. These bills, although I was often very vocal or a chief sponsor or a regular sponsor, these bills got across the finish line because of a group effort, whether that was fellow legislators or advocates in the community and the state. Definitely a group effort in getting everything that I've been a part of getting done across the finish line.
You're really doing some great work out there.
It's really important that I mention the Oregon Federation of Nurses and Healthcare Professionals, also known as OFNHP, and AFSCME. Without them, it would not have been possible to get the initiatives that we put forth across the finish line.
Yeah, it's always a group effort.
Absolutely.
Hannah's Law, 2948, has to do with school nursing. Can you tell us about the importance of the name of that law and why it came to be?
Yeah, this is a bill that was brought to me by a mom who has a child who is disabled and had a very unfortunate incident in school in which an administrator directed an aide against the advice of nursing to administer tube feedings to the child. And the aide had very little, if any, training on how to do that. And the child ended up getting pretty severe aspiration pneumonia. And so I was approached about creating this law and really fighting for it. And we were able to get it across the finish line. And so Hannah's Law says that only nurses will be allowed to direct nursing care in schools in the state of Oregon. Non nurses will not be allowed to direct nursing care in our public schools. And so I think that's a fantastic achievement. And I think it will lead to kids being healthier across our state.
Yeah, 100%. I have to share with you a story. I think I've shared this one once before, but when my kids were in elementary school, I went into the nurse's office in the school to drop off some asthma medication for my son. And they call him a FOSFA here, first aid safety assistant, very little training, not a nurse, was in the office. And there was a student there who was, to me, a pediatric nurse, clearly in respiratory distress, clearly
Mm.
tripoding, everything, all of the signs, right? And the quote unquote nurse sent her back to class, said, "You're fine. You're fine. Walk it off. Go back to class." And I was appalled. And I said, "Look, she's not fine. And you need to call the nurse that's assigned to this school." And I got so much pushback and resistance from her. "Oh, no, she does this all the time." Yeah, but she doesn't fake tripoding and tachypnea and use of accessory muscles and,
Yeah.
the retractions and all of that. Like, come on, you need to call the nurse. And I'm telling you, if you don't, I will. So I've seen firsthand, they think that they're doing the right thing, but they simply don't have the education that a nurse has. And there's been a lot of horror stories. So I applaud you for that bill as well.
Yeah. There's a reason why we have school nurses, and there's a reason why we require that they have the training that they do because nurses have that nursing instinct. Nurses know, and we need great school nurses to be listened to so that our kids be as healthy as possible in our school system.
Yeah. Can you walk us through some of the healthcare or nursing related bills that you've been involved with that I haven't touched on? I know you've done some work with workplace violence and billing for Medicaid recently. Can you tell us about that?
Yeah, so there's House Bill 2789, which passed this last legislative session, and that is a bill that makes Oregon the first state in the country, based on my understanding, to allow nurses to bill for Medicaid, and specifically, it's related to care coordinating services. So rulemaking is currently being done on that, and I'm looking forward to that bill getting implemented next year. It's pretty exciting. For too long, nurses haven't been treated the way the doctors are when it comes to hospital billing. We've been billed basically along with the meals. And it's
Yeah.
about time that nurses be able to be reimbursed appropriately for the care that they provide. And I think this bill is a good first step towards that. Senate Bill 170 is a bill that was passed this past legislative session. And that bill states that it's basically a three strikes and you're out type of bill. So after a public servant is assaulted for a third time, it becomes a felony. The first two times are misdemeanors. And this bill was basically a compromise piece of legislation because I had brought a bill before that had said that it would be just a straight up felony to assault a nurse. And that piece of legislation made a lot of folks in the disability rights community nervous. And so we really worked hard to find some middle ground that moved the ball forward in the state of Oregon to meet the needs of nurses and healthcare workers and other public servants who really wanted it to be a felony crime for a healthcare worker or a public servant to be assaulted. And so that's one piece of the workplace violence legislation that was passed. There was also Senate Bill 537, which put in place a bunch of other protections for healthcare workers and required things like pretty extensive training, workplace violence committees, and requires that new ERs and remodeled ERs have bulletproof glass.
Oh, that's good. That's really good. I hadn't heard that part. That's amazing. Yeah, we've got to take our wins where we can get them, right? Every little bit helps.
Absolutely.
For 2789 for the billing, is that specific to nurse practitioners?
No, no, that's registered nurses.
So how does that work? Can you kind of explain that to me?
Yeah, 2789. So, for instance, let's just say there is a nurse or a group of nurses that wanted to start a business where they do care coordinating work or case management work. They could start that business, and then instead of relying on a nurse practitioner, physician assistant, or a doctor to be that conduit to bill for Medicaid, they can bill for that service directly. So it will create new
Okay,
opportunities for nurses, hopefully
got it.
to do that work.
Yeah, and that's actually so exciting because I've been saying forever and ever that would be such a game changer if we could simply bill for nursing services. It would immediately change overnight. We would suddenly be respected and valued by our employers, right? We need CMS to revamp that whole thing. But anyway, don't get me
We
started.
do, and that's I hear you, and that's more on the Medicare side with CMS, and this bill doesn't do anything on that
Yeah.
front. It's mainly focusing in on Medicaid, which in the state of
Yeah.
Oregon, at least for now, we have a pretty robust Medicaid system that serves our state very well. It's called the Oregon Health Plan, and in fact, currently in the state of Oregon, we've got about last I heard, 96% of the population in our state has some form of healthcare coverage.
Okay. All right. Are there any upcoming healthcare related bills or initiatives that you're especially excited about or that we should keep an eye on, whether it's state or federal? Anything we should put on the radar?
Well, the short session is coming up in Oregon in February, and we are going to be focused in on dealing with the SNAP cuts that are coming down from the federal level and the Medicaid cuts, and just figuring out where we go from there. I've heard that as much as $15 billion is going to have to be cut from the state budget because of the cuts at the federal level, and so that's
Wow.
going to be absolutely terrible for patients. It's not going to be great for nurses because a lot of that Medicaid money is going to hospitals and places where nurses work. And so there's going to be some tough choices that are going to have to be made, unfortunately.
Let's talk about unions for a second. What do you say to nurses who might be hesitant about unions or worry about retaliation from employers? This is my daily struggle.
Yeah. First of all, I'll say not every single union is created equal. I know that
That's
there are
true.
some unions that are definitely better than others. That said, I think unions do a fantastic job of representing most nurses, and they do a great job of getting contracts that enshrine a nurse's rights into a legally binding and legally protected document. And that actually means something. And if you are a nurse that's concerned about your union or concerned about what's being negotiated at the bargaining table, get involved with the union. Unions are always looking to
Yes.
recruit. Run for an office, sit on a committee, get to know your union leaders and make your voice known. That's what I did. That's how I got involved. That's why I'm in the position that I'm in today to impact policy for an entire state. So get involved. When it comes to retaliation, again, there are some great hospitals out there. There are some workspaces where they don't need unions because the hospitals do a great job of listening to their staff and taking care of their staff. But that is not all hospitals. And there are hospitals that do retaliate and try to retaliate. I would just advise nurses to get involved with the union because there are protections there when you actually get involved. There are federal protections,
Yeah.
and I'd say by and large, unions do a good job of protecting their leaders that step out and put their necks on the line. And I have been part of multiple situations over the years where the union that I work for, the Washington State Nurses Association, has gone to bat for officers when hospitals have tried to retaliate. I'm actually going through a little bit of that right now with a hospital in Puyallup, Washington.
Okay. Yeah. I always tell nurses if you're not happy with your union, you need to get involved because you are the union. You don't have to just accept everything they say. You can get involved. You can contact them. You can reach out. You can try to get better understanding of why things are. And whether we like it or not, whether we want to admit it or not, the only two ways to affect change, real change for nurses in this country is legislation and unions. That's it. So if you want to be part of the change, you need to support legislation and unions, right?
Yeah,
I need to get that
unions.
tattooed.
Un- I am with you. Unions are democratic organizations, and the leaders of most of the union locals in this country work beside you at the bedside.
Yeah.
Get to know them because the people who speak up and get involved are the ones who shape the rules and shape the contracts. So have your voice be heard, speak up, organize your coworkers, and be the change you want to see.
Looking back, what's the most powerful lesson that you learned from your time as a union leader that you still use today as a lawmaker?
Most powerful lesson that I've learned. Wow, that's a great question. I would say to listen, right? I think that's a
Mhm.
skill that we as nurses really hone, and it's something that you really need to be a great nurse and to be a great union leader. Listen and then put what you've heard into action. And I do that as a lawmaker as well. So, really being a good listener and then turning what I've heard into action.
Yeah. From your vantage point, how can unions and legislators work together to improve conditions for nurses?
Well, that's something I think we do a really good job of here in Oregon. The Oregon Nurses Association has a strong presence in Salem. The Oregon Nurses Association has good relationships with legislators, and I know that they try to do that work on both sides of the aisles. I think it's important to have your union and your professional nurses association being engaged on the ground in Capitol buildings and do the work of bringing members to legislative offices and those who are actually doing the work in the hospital setting so that legislators get a real understanding of what it's like to be a nurse and what that work is like because so many legislators have no idea what it is really like being a nurse. They tend to
No
think
idea.
that tend to think that being a nurse is a lot like what they see on TV, and nurses don't wear white hats and all white anymore. And the job is a lot harder in a lot of ways than it was 30 years ago.
Yeah, a lot more technical, and a lot more responsibility. Absolutely. You're the first Black LGBTQ plus member of the Oregon House. What does that milestone mean to you personally and professionally?
Yeah, to be frank with you, it's actually something that almost kept me from running for office because,
Really?
yeah, well, there's a longer story here, but I took the seat of the person who's now governor. Tina Kotek is the governor of Oregon. She used to represent this House District 44, which covers most of North Portland and part of Northeast Portland. And when she stepped down to pursue the governorship, folks encouraged me to run for the seat. And when I was thinking about it, and I looked at the landscape and I looked at the history of Oregon and the history of the Oregon legislature, I saw that there had never been anyone like me who has ever won a legislative seat in our state before, and there are very few in the entire country. And so that was something that made me pause for a moment because I wondered how I
I'm
would be
sure.
treated and how it would be possible for me to win. Now, luckily, this is one of the most progressive seats in the entire state. And when I put my name forward to run, I ended up getting a lot of support and won my primary with about 90% of the vote. Um,
Wow.
yeah, that was definitely an honor. But since joining the legislature, it definitely has been a challenge being the only person like me to serve. I'm constantly having to speak up and push back against a lot of the haters, especially folks, on the internet who don't love the fact that I'm a legislator and speak up about the things that I speak up about. And so it has been tough, but it's also been an opportunity for folks who may never have known someone like me to get to know someone like me, especially across the aisle. And I've been fortunate to have made a lot of really strong relationships with Republicans who also serve in the building. I think it's been good for both myself and the Republicans that I've gotten to know and have been able to collaborate with on some issues.
Do you feel a responsibility to mentor or inspire other nurses and underrepresented voices to pursue public offices like you?
Oh yeah, absolutely. I mean, if you follow me on social media, you'll see that I'm always out there doing things with nurses. I
Yes,
try to
you
get
are.
out in the community. I love working with young people, people who are thinking about pursuing nursing, people who want to get involved with the legislative process, because it is important that our legislature, that our city councils, that our county councils, all levels of government be diverse and be representative of the broad voices that make up both America and Oregon. And so I try to be that change that I want to see, and I strongly believe in doing the work. And so, absolutely, I believe in mentoring, and it's one of the things that brings me joy.
Now for your enema of the week.
Let's take a moment to hear a word from our sponsor. As a registered nurse, I've seen firsthand what happens to the body after surgery. And now, recovering from recent surgery myself, I can tell you it's real. Between the anesthesia, the pain medications, and the decreased activity, constipation is almost guaranteed. And it's one of those things nobody talks about, but everyone experiences at one time or another. When your body's healing, the last thing you want is that heavy, bloated, uncomfortable feeling. Your digestive system slows down, your appetite changes, and suddenly, even something as simple as going to the bathroom becomes complicated. That's where gentle at home gut support can make such a difference. Whether you're dealing with post surgery sluggishness, travel related constipation, or just wanting to feel lighter and more balanced, supporting your gut health is key. Happy Bum Co. is a leader in at home enema solutions and gut health solutions. Their kits are beautifully designed, easy to use, and made from medical grade materials. No sketchy chemicals, no complicated setup, just safe, effective, evidence based relief that helps you reconnect with your body's natural rhythm. As a nurse, I can tell you that your gut health impacts everything: mood, energy, skin, even immune function. So, whether you're recovering, resetting, or simply taking charge of your wellness, supporting detoxification through natural methods can make a huge difference in how you feel day to day. If you're interested in learning more, check out happybumco.com and use code NURSESUNCORKED. They have amazing educational resources and products for every level of experience. You can find the link in the episode description. And remember, this is about giving your body a little extra care when it needs it most. Recovery is never easy, but feeling good from the inside out makes all the difference. Take it slow, take care of yourself, and as always, listen to your gut. Visit happybumco.com and use promo code NURSESUNCORKED for 15% off your first bundle. This week's Enema of the Week award goes to none other than the Joint Commission. They recently announced they are including nurse staffing as a national performance goal for 2026, and everyone celebrated this as a big win. Well, you know me. I went and read the entire thing, and I'm here to tell you that it absolutely has no teeth. It defers all of the decision making regarding any kind of nurse to patient staffing ratios to administration, not to the bedside nurse. And here's what you need to understand: it's not enforceable at all. Goal number 12 of the National Performance Goals for next year reads, quote, "The hospital is staffed to meet the needs of the patients it serves, and staff is competent to provide safe, quality care." End quote. That's it. That's it. Now, here's the breakdown of the goal. The vast majority of it doesn't even have anything to do with nursing. It talks about pharmacy and surgical services and therapy and all these other things. It has a whole section on nurse executives' education, background checks being important for hiring nurses, health screenings, documented competencies, all this other stuff that again has nothing to do with nurse to patient ratios. Then finally, there's a short section about nursing, and all it says is that there must be an RN or an LPN, LVN available. That's it. So you could easily interpret that to fit your needs, to fit AKA your business model, to say that, well, there was an RN in the building. Yeah, the house soup, whomever, the manager that left at 4, someone is on call that's a nurse, right? But not necessarily a nurse right there in the unit that's treating the patients. And then it says that they have to, as part of this goal, evaluate the effectiveness once a year. And the nurse executive has to write a report. And they should include the possibility for nurse staffing in any identified problems. But you see, they're the ones that get to decide that. They are writing the report, that they get to decide if there's even a problem and what led to the problem. That's all up to them and their interpretation. And then they just have to, quote unquote, address it somehow, if they even identify that there's a problem, right? They get to do this in any way that they see fit. There is nothing about actual nurse to patient ratios in this goal. Nothing. This permits management to staff by the magical acuity model, which they manipulate to fit their business model. The only model that works is actually mandated nurse to patient ratios, right? Numbers based on specialty. 1 nurse, 2 patients in ICU. 1 nurse, 5 patients med surg, whatever it may be, because that is objective and that is enforceable. The bottom line is this goal that Joint Commission put out is purposely vague. It is subjective, it is inconsistently applied, and it is not enforceable. This is nothing more than a red herring to pacify nurses because we've been so critical of Joint Commission since COVID. And that is why this week's Enema of the Week award goes to the Joint Commission. Well deserved. Not a serious question, but I thought I'd have to ask anyway. Early on, you gained notice for your impeccable sense of style and fashion. How did it feel to be called the best dressed lawmaker in the building?
Oh, well, I can think of a couple other legislators that dress well as well, but I do like wearing suits when session is in. I really take the work of being a legislator seriously. Again, there are not very many people like me at all who've ever served in a legislature. And yeah, I like to dress up when session is in, and it's interesting that folks have chosen to recognize that.
I love it. What advice would you give specifically to nurses who maybe are considering going into politics? It's something I get asked all the time if I will, and I don't want to, but I'm so impressed with
Um,
those that do.
Well, I would tell them to find a good training program if they are thinking about it. There are all different types of programs in different states that teach candidates how to run for office. Before I decided to run, I did what's called the Oregon Labor Candidate School. It's basically a union candidate training program in the state of Oregon. A lot of states have those. Reach out to your state labor association or AFL-CIO and inquire if that's something that you're thinking about. There are also different candidate schools for women, for instance, that are in just about every single state. Emerge is a nationwide program that teaches women how to run for office. So get involved in one of those programs so that you understand the basic nuts and bolts of how to run. And then after you've done that, just remember that when nurses run for office, we have a disproportionately high record of winning because people trust nurses, people love
Is
nurses,
that
and there
true?
are
I
not
didn't know that.
enough. Yeah, that's something I learned when I was on the American Nurses Association PAC board. I was vice chair of the ANA PAC board for a while and co-chair of the Leadership Society. And yeah, that's something that I learned. When nurses run, we often win because the public trusts us, and there are not enough of us in office. And when you're running, keep reminding people of that there aren't other nurses and those voices aren't being heard. And the voices of those who do direct patient care often are not being considered when laws and rules and regulations are being made. And in my experience, the public is hungry for nurses to be in public office. So run, 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 run.
That's actually very inspiring to hear. I was not aware of that. We had a nurse here in Las Vegas, where I am, that was running for a local position, and she unfortunately did not make it. I was supporting her, but that's very inspiring, I think, to hear, because I assume a lot of nurses probably think, "Oh, I don't have what it takes. I don't have the experience in that area." So I'm glad that you said that. I appreciate
Well,
that.
and don't be afraid to lean into nurses. A mistake that I think a lot of nurses who run for office make is not leaning into being a nurse the way that they really should. They'll say that they're a nurse, it might be in some of the written material, but I put RN big on my yard signs. I
I
talk
love it.
about being a nurse. I have normal sinus rhythm on a lot of the stuff that comes from Representative Travis Nelson. A lot of people know me as Nurse Nelson. I haven't truly been at the bedside in over a decade, although I've done some work in the hospital setting, and you'll still see me in scrubs a lot. I'll go out in public in my scrubs because I've earned the right to do so. But
Yeah.
that all of that helps, and it's helped with my name ID because people know me, like I said, as Nurse Nelson. So if you're gonna run as a nurse, lean into it big time. Don't be afraid to put RN everywhere and make it known that you are a nurse.
Good advice, and yours has a nice ring to it, Nurse Nelson. So, yeah, you gotta use that.
Absolutely.
What are you most proud of as a state representative?
Wow. I'm proud of the legislation that I've been a part of that will make a difference in the lives of Oregonians and the lives of patients across our state. I said earlier, I believe that I'm doing patient care by doing the work that I'm doing to make the lives of nurses and patients better. And I'm extremely proud of that because with a bill like the nurse ratio bill, for instance, we know
Yeah.
that when nurses have less patients, patients are more likely to survive and thrive when they're in the hospital. And so I'm extremely honored and proud to be in a position to where I can do this work that makes the lives of nurses and patients and the public better.
What do you think the public misunderstands most about nursing as a profession? I know I asked you earlier about legislators, but what do you think the biggest public misconception is?
I just don't think they understand how difficult nursing is. And I think that there is a lot of the public that thinks that nurses make good money doing work that is easy. And the work of being a nurse is extremely hard, especially in the hospital and nursing home setting. You're working 12-hour shifts. You're often working multiple shifts in a row. You're being run ragged. You're dealing with people who are extremely needy and sick. And you're oftentimes, again, not always, because there are great hospitals and workplaces, but you're often underappreciated by the
Uh-huh.
hospitals and supervisors that are managing you. And so the public, in my experience, just doesn't really understand that. And that's got to change.
I agree. Yeah, it's very challenging. I think a lot of them still view nurses as if it was the 60s, the 50s, that stereotypical. They have no idea how technical, how science-based, and how challenging it is, and it's very difficult to get them to understand that.
Yeah, and a lot of
Looking
these
at,
hospital systems, right, and healthcare facilities, they put out a lot of this great advertising and these great images that leads the public to think that they really love and value their nurses. And again, not to say that some of them don't, but I have not found that to be the standard as it relates to how nurses are treated in the hospital setting in at least the Northwest.
yeah, I think just about everywhere.
Yeah.
Looking ahead, what's your long-term vision for healthcare in Oregon, and what role do you see nurses playing in that future?
Well, I want our state to be a state where nurses thrive, where nurses are delivering fantastic care because they're being set up for success. I also am a big supporter of universal health care. I was a part of a bill that passed a couple of years ago, Senate Bill 1089, which created the Universal Healthcare Governance Board. That board is doing work to figure out how Oregon can create its own type of universal healthcare plan. The report is due out next year. I think some of the work is being complicated a little bit by the cuts to Medicaid that are coming down from the federal level, but I really want every single person in our state and in our country to be able to get health care without worrying about the price and the cost. I've
Yes.
had family that have passed away because not because they didn't have money, because they were middle class folks, but they hesitated in going to the doctor until it was too late because they were
Mhm.
concerned with the bill and were hoping that they would just get better instead of getting the interventions that they needed. And I don't want anyone to have to go through that. We are the wealthiest country on the planet. We are making we are making a lot of millionaires and billionaires every single day in the United States. And eh, I believe that given those facts, that no matter how much you make, you should not have to have the cost of healthcare be a factor in whether you get treatment or not.
Absolutely. Where can people find you, follow your journey, and support you? I know you're on social media because I follow you.
I am. I am. Thank you so much, Nurse Erica. I'm on Instagram. I'm on Facebook. I'm on X. I'm on Blue Sky. So, yeah, look me up. State Representative Travis Nelson. Follow me, DM me, hit me up. And if you've got suggestions or things you think I should be working on, let's talk. Try to be pretty responsive to the folks that follow me and reach out.
Oh, you are because I reach out to you all the time and you always respond to me. And I will put the links to your social media in the description of the episode for everybody. Thank you so
That would be
much,
fantastic.
Representative Nelson. Thank you for sharing part of your weekend with us and inspiring, hopefully, more nurses to go into politics. I really admire the work that you're doing. We need more like you. Keep going. Thank you so much.
Thank you so much, Nurse Erica.
All right. Who's feeling inspired now? I am. I've kind of toyed with the idea for a while of politics. Lots of people have encouraged me. I don't think it's in the cards for me, but I am so impressed with Representative Nelson for fighting the good fight on behalf of nurses everywhere. If you loved this episode, please consider becoming a patron. There is a link in the episode description. Don't forget to share Nurses Uncorked with your friends and colleagues and family and download episodes. Until next time, keep advocating, keep learning, and don't let the bastards grind you down. I'm Nurse Erica, and I thank you for listening.